Back to you.
Thank you, Kevin. Today for your child, maybe you've noticed some telltale behaviors in your child, such as staring off into space, involuntary movements or sounds, odd social behaviors. Autism is not an illness, but a condition that people are born with that makes their brains work a little differently. And cases of autism are drastically on the rise. According to the Autism Community in Action, cases are up by more than 400% since the year 2000. That's 1 out of every 36 children. And one doctor thinks she knows why. Dr. Doreen Granpeesheh, founder of Autism Care Today and co-founder of the Autism Media Network, joins us. Thanks for being here.
Thank you very much. It's a pleasure.
Well, doctor, you don't believe that the increase in autism cases is due to more testing or more cases being reported. But in your decades of research on the cause of autism, which myths have been debunked and what do you believe could really be causing this spike in autism and why?
Yeah, so, I mean, there's no question that better diagnosis and awareness is contributing to some extent. Obviously, there's a lot more awareness. So doctors are diagnosing more readily. But this increase is tremendous. You know, when I started in this field about 44 years ago, it was 1 in 10,000 children. So just getting better at diagnosis and awareness can't explain this increase. There have been so many myths about what causes autism. I mean, just 50 years ago, people believed it had to do with cold parenting. It was called the refrigerator mother was causing autism. But over the years, you know, over the last few decades, we've actually learned quite a bit. Autism is a disorder that involves a genetic predisposition that interacts or is triggered by an environmental factor. That genetic component has mostly to do with what's called redox, or the ability to detoxify. And the environmental component is believed to be all the toxins in our environment, and primarily pesticides in our food. And exposure, whether it's in utero or after birth, exposure to toxins when you cannot detoxify has had a lot of relationship with the symptoms of autism.
Okay, so your thoughts then are toxicity, pesticides perhaps in our food supply. So tell us,
Definitely.
Why does autism often come with other medical and mental health issues as well, and what are some of the most common?
That's a great question. So, you know, toxicity, of course, affects the whole body, right? And so we see very commonly with individuals who have autism, both medical or biological as well as mental problems. So, for instance, a very large percentage of individuals with autism also have gastrointestinal problems. They have celiac, they have inflammation, they have reflux, bloating, they have allergies to certain foods. So that's a very prominent problem. And of course, a lot of individuals with autism also have sleep problems. And on the mental disorders side, yeah, there's a pretty high correlation with anxiety, with depression. If you can think with things like obsessive compulsive behavior, if you can think of how difficult it is to survive when you have difficulty socializing or understanding others, then those types of things will automatically lead to some of those mental problems like anxiety, for instance, or depression that comes from being socially isolated.
Okay, and there are 3 levels of autism, 9 subtypes, so there are a few, and cases range, of course, from mild to severe. So after someone receives a diagnosis, do you have any recommendations for books or websites, any resources to help parents better understand their child?
Thank you for asking that. There are, I think for parents, there are several books that are written by other parents. And I find these books to be very helpful because other parents really understand the journey. My favorite is Autism Parent to Parent by Shannon Penrod. That's a really good book. And there's also another book called A Real Boy by Christina Adams. And last but not least, a more recent book is called Saving My Sons by Ilana Gershowitz. I believe all of these are available on Amazon, and they're very helpful to guide parents on this journey.
Okay, great. Well, those are great resources. Also, there are two terms in the autism community. One is called stimming, which might be like tapping, clapping, making odd sounds. It's an emotional release for them. And the other term is called masking, which is when parents may teach their child with autism to hide things like stimming, because some may consider those quirks socially unacceptable. But masking can be emotionally exhausting for people with autism. So what are your thoughts on masking? Should they or should they not?
So, stimming, or what we call stereotypical behavior, we don't really know for sure if it's a release or if it's something that helps the individual calm down. Nobody really knows what's causing the self-stimulatory behavior. But certainly for individuals who are able to mask that type of behavior or any other type of behavior, it could be difficult for them. But realistically, I think over time, a lot of individuals with autism learn kind of social norms. And, in social norms and in social interaction, we all mask some of the behaviors that we would otherwise perhaps show. So yes, one has to be very careful not to cause anxiety or those types of things by teaching someone to mask their symptoms. But at the same time, sometimes the individuals themselves prefer to not exhibit those behaviors so that they're more socially acceptable.
All right, Dr. Granpeesheh, I have so many more questions. We'll have to bring you back on next time. Thank you so much for being here, for your 44 years of work with the autism community. We appreciate it. And for more information, you can go to her website, DoreenGranpeesheh.com, or you can find her at Ask Dr. Doreen on Instagram or TikTok. We'll be right back.